people are being let in now. They're all joining us. So thank you for joining Perspectives for our free webinar or virtual workshop today. My name is Jonathan Eisler. I'm the Vice President of Organizational Consulting and Business Development for Perspectives. We created this series to share expertise and guidance that can be helpful for addressing the unprecedented challenges that the coronavirus pandemic has been presenting to employers. If you've been following along, you know that so far we've held sessions on remote leadership, on leading through a crisis, and also conducting effective virtual meetings. Now today we're excited to have two members of our account management team join us, and they're both going to share what Perspectives is seeing lately from employees and their families that have been reaching out to our Access Center for support through our Employee Assistance Program. We're also going to give you a glimpse into what our account managers who work with our customer contacts every day are discussing in terms of their organizational needs around COVID. Now, these views and stories will give you insight into what your employees and your professional counterparts are experiencing, along with some ideas on how you can support them. We're also sure you'll find some great resources here for yourself as well, and others in your social and familial circles. So even beyond just our professional setting, because we're all impacted during this time. As with the previous sessions, we're going to be sending out the link for this recording within the coming 2 or 3 days, so stay tuned. We'll also include some other information about valuable resources during these times. So now I'd like to introduce you to today's speakers. First, we have Kelly Calderon. She received her master's in clinical mental health counseling from Governor State University and her bachelor's in psychology from St. Ambrose University. Previously, she was a counselor in the Perspectives Access Center and for the Employee Assistance Program. She's an LPC, which is a licensed professional counselor in Illinois, and she's working towards becoming a licensed clinical professional counselor, also known as an LCPC. Secondly, we have Jory Cotton. She's an account manager with Perspectives for more than 5 years now, and she received a BS in advertising from the University of Colorado at Boulder, and she holds a master's in clinical counseling psychology from my personal alma mater, the Chicago School of Professional Psychology. She became a licensed clinical professional counselor in 2011, and she's also a global career development facilitator, which she earned that credential in 2013. With that, I would like to turn it over to Kelly. Let's see if I can make this work. There we go.
Thank you, Jonathan. So I'm going to share my screen, and while we do this, me and Jory are going to turn our videos off just because we find that the streaming is a little bit more efficient when we do that. So bear with me for a moment.
Kelly, real quick, while you're doing that, I just want to mention, we do have everybody on mute right now because there's a lot of people that are attending, but I will be helping to support Jory and Kelly by watching the chat feature down at the bottom of your screen, as well as the Q&A. We won't really be using the Q&A, but if you do have questions or comments you'd like to make, throw them in the chat, and then I can flag the presenters as appropriate. So that, I'm going to go on mute.
Thanks, Jonathan. All right. Hello, everyone. So during this stressful time, we need to ensure that we're taking care of ourselves as well as our communities. So as you're aware, COVID-19 is greatly impacting our overall well-being. This webinar offers some solutions and strategies to help alleviate some short-term and long-term consequences of our current state. My hope is that our discussion serves as a gentle reminder to take notice of what's happening around us, and also to pay attention to others, as well as validate how you've been feeling and come up with some effective personal strategies for self-care. So we wanted to make this information available to you, whether you're a customer of Perspectives or not, because it is beneficial to understand what your employees may be experiencing and feeling, as well as what others in your role are requesting to manage the current crisis. So we hope this helps you plan and make decisions during the crisis more effectively. So first, we'll talk about some common responses to the crisis. So these are some symptoms either you or your employees might be experiencing during this time. So some may be experiencing one or several of these symptoms. I've actually spoken to a few people on the front lines in healthcare that have specific fears of not just being infected, but also taking the virus home with them. So these are very real and very authentic feelings, and that's okay. These are normal responses. What's not okay is ignoring them. Our mind and body send messages to us, and it's our job to take a moment to address them. So we've had multiple requests from not only employees, but their employers on what they are noticing in terms of symptoms. I think it's important to recognize that what we're hearing is very close to what people may feel when they are grieving. So in a sense, we're all grieving multiple losses during this time. And our goal is to help employees and customers process and manage these symptoms with grief. So keep this in mind, as it is possible your team members are grieving on some level. We all have a personal stress profile. Some experience more physical symptoms such as muscle aches, pains, fatigue, headache, or even high blood pressure. Cognitive symptoms can include things like forgetfulness, poor judgment, being disorganized or pessimistic. Often our stress will also impact our emotional state. So we can experience symptoms of depression or anxiety, ruminating thoughts, feelings of anger, hopelessness, or sometimes even shame. How we think and feel also impacts our actions. So maybe you've noticed differences in your behavior, whether you're becoming more irritable, lacking patience, isolating yourself, or seeing this happen in team members as well. I hear this from employees who say that they went to the ER because they thought they were having a heart attack when really it was a panic attack. Or someone who's been struggling to perform normal tasks at work because their stress level is so high that they're forgetting how to do tasks that normally they'd be able to do. It shows you that stress can come in many different forms, and it's important to recognize how you, as well as the people that you work with, handle and show the stress in order to manage it better. So the more self-aware you are of your triggers, the quicker you can take action to minimize the effects. And this becomes especially hard when you have a remote workforce and are limited to observing people. So, when you're used to seeing people during that 30-minute, once per week check-in or similar brief encounter. So most of us live our lives in a state of balance with a self-regulating biological system that helps to adjust to changes in events. So when an adverse event or significant stressor such as COVID-19 occurs, we make a cognitive interpretation and assign a meaning to it. So these are unique to each individual, and they're key factors in engaging the appropriate level of stress response. So the messages our body and mind send us are very important for our survival. They help us to understand actual danger or threats. So we learn from our past so that we can inform our present. There are both pros and cons to the biological survival mechanism. The pros are that the mind is protected. It deflects us from harm, emotional or physical. Our minds and bodies help to keep us from experiencing danger. Some of the cons are that we can tend to develop poor coping mechanisms, such as ignoring, numbing, isolating, self-medicating, whether that be food, alcohol, or even medications and drugs, among other things. These are the kind of issues that Perspectives assists with every day. Again, we hope that you will be aware of the varied ways your team members may process what's going on with the coronavirus and their specific situations. So in the next two sections, we're actually going to illustrate in more detail the kind of individual challenges that we see and how we're responding to them. So whether they're from employees or from our customer organizations. So focusing on individual services, we've compiled real-time testimonials from clients regarding their struggles and how we're reacting to them. So I'm not going to read all of these through, but kind of as an overview, there's many reasons that people call us regarding support from the impact of COVID-19. So we understand that obviously this is a very stressful time. There's a lot of unknown factors that add to the stress and anxiety. At Perspectives, we want to support our customers, employees in any way that we can. So here are some of the ways that we help individuals as it relates to emotional and mental health. So we're seeing employees calling in for anxiety that developed into physical symptoms, like I said before, because they're on the front lines. So we were able to provide phone counseling for them to help alleviate some of these symptoms. There was also a situation where someone called for resources since their whole family is now working and e-learning from home. So we were able to send them some tip sheets to help balance some of these changes. We're also seeing an increase in people feeling lonely or depressed, as well as adjusting to new changes, such as a teacher who now has to teach via e-learning. We're able to either help these employees in the moment if they need it, since we're available 24/7, 365, or set them up with telehealth counseling. Aside from mental health, there are also common requests that we have in recent weeks that are ways that we've provided other services through Perspectives, including legal, financial, career, nutritional, childcare, elder care, and many others that a client may need to gather resources and or consult. So the top requests that we're hearing that were not common before COVID-19 are someone looking for elder care resources because one of their parent is a caretaker for the other. So they're concerned about what to do if their caretaker parent contracts the virus. We also have seen a lot of requests for childcare since some of our customers are essential workers and cannot rely on family right now for help. So we're able to help them get some childcare services as well. And we're seeing employees who call in because maybe their spouse lost their job. We're able to provide financial consultations as well as set up the spouse for a consultation with a career counselor to help with job searches and even their resume. So how Perspectives can help. Organizations like Perspectives can help in multiple ways during a crisis. So we need to be proactive, available, empathetic, and we really need our customers and clients to not just know, but to actually feel that we're there with them. As important as mental health is right now, it's not the only factor we need to take into consideration with how people are struggling. We also want to stress that sometimes people contact us and they really don't know what they need. That's why we staff our Access Center with master's level counselors only. We start with an assessment to hear them and figure out what resources might be beneficial, with the idea of helping in the moment whenever possible, or referring to the right legal, career, childcare, or other resources for quick assistance. So if you're considering an employee assistance program or mental and work-life resource, we encourage you to confirm that there is triaging upfront by experts, because many people have a hard time identifying the name of what they're suffering or the best way to even feel better. So I'm going to hand it over to Jory now to discuss our services from an organizational standpoint.
Thank you, Kelly. So in addition to individual support, Perspectives helps customer organization addressing challenges during COVID-19. So one of the most important findings that we've had in collaborating with leadership is that they understand the need for services for their staff, but they're looking to us at Perspectives for direction and resources. And you can probably relate to what you're going to be hearing next. Furthermore, we've learned over the course of several decades that there are often issues based on specific industries and other factors, and we create strategies based on these needs. This is an area of expertise for Perspectives, as we have built specialties for various sectors such as healthcare and first responders and their employee experiences. For organizational leadership, we are tailoring our interventions to include managing a remote workforce, tips for effective remote meetings, and leadership in a crisis. We are also going to be covering compensation and legal risks. So think about the Department of Labor, ADA, FMLA, and many more. We are also helping to create policies for employees both working from home and getting back to work, because these are also hot topics that we will be addressing in future webinars. So healthcare is an industry sector that has been particularly impacted by COVID-19, and these employees have special needs. When initially collaborating with healthcare organizations, we realized they were acutely aware their staff members require mental health and wellness services, but again, they weren't necessarily sure what it is that they were looking for in terms of support for them and deliverables. During these conversations, we honed in and really listened to what supervisors and managers were hearing and seeing from their staff behaviorally. We learned that employees were, and of course still are, experiencing high levels of stress, anxiety, trauma, grief, and exhaustion. From there, we collaborated with leadership to create a comprehensive strategy for addressing employees' needs with multiple touch points. So for example, we are providing materials to social workers, counselors, and clergy to be handed out to staff members and placed throughout facilities so our contact information is consistently visible. Many healthcare organizations are providing community computers to be utilized for counseling sessions during shifts. We have also created video content outlining services. They can access Perspectives and all the ways to connect with our counselors, which we will illustrate further in a few minutes. On an ongoing basis, we have weekly meetings with organizational leadership to assess changing needs and provide feedback as we continue on this journey. We have collaborated with them to ensure perspectives information is included in communications from leadership to staff members, highlighting our availability. As you can imagine, these employees need these services, but they don't have a lot of time in their hands. So we're creating short video content, providing a variety of tips for taking care of themselves. This content is also being offered live as well. Finally, we've provided giveaways to healthcare accounts to make care packages for frontline workers, which also keeps our contact information in front of them for the times when they do really need to reach out. Some healthcare organizations have asked for critical incident stress debriefs, and we call them CISDs in the EAP realm. This is basically an emergency intervention for staff who are affected by an adverse event. For example, one of the organizations that we work with had a frontline employee pass away from COVID-19. In response, we scheduled a virtual group session for all staff directly impacted to assist with processing and normalizing their feelings regarding the event. It's important to note that we provide CISD services for customers in any industry, not just healthcare, who may have experienced a traumatic event or events, such as the passing of an employee. During normal times, we offer these services in person, but of course, we are leading virtual groups at this time. There is no question that first responders have some of the greatest risk during COVID-19. They respond to calls and are required to act with very limited information. We are partnering with municipalities and providing materials for first responders to increase their understanding of symptoms of compassion fatigue, such as chronic mental and physical exhaustion, feelings of guilt or fear, substance abuse issues, and of course, nightmares and flashbacks. Stress for first responders can be intense during a pandemic. We are providing psychoeducation on ways to increase well-being so they can focus on their jobs. Stress can be mitigated with simple cognitive shifts to assist them with remaining hopeful, staying calm, and improving their sense of control and competence. We are committed to working with first responders to ensure safety for themselves and, of course, their families. Moving forward, municipalities have expressed concern about employees returning to normal work. We're actively working with these organizations to create a comprehensive strategy to address issues related to experiencing prolonged stress. We also plan to offer future webinars that help participants envision a back to work plan. But you probably realize that we are currently in a state of flux with different requirements of different states and industries. Next. Jobs that have been deemed essential are stressful under normal circumstances due to low wages, physical demands, and numerous customer interactions, which increase the risk of exposure. As a result, they are coping with high levels of anxiety, depression, and fear of bringing the virus home to their families. These fears are further exacerbated by customers who won't wear masks or are not observing social distancing directives. In response, we are working with leadership to ensure staff know they have prospective services available. We are leveraging real-time data to measure how we are engaging with employees. For example, after close analysis of data presented in an annual impact report with a manufacturing organization, which was showing lower than expected utilization, just as an FYI, impact reports offer an overview of the percentage of the program use by employees and includes their identified presenting problems. So through some deep digging and some research, we discovered that one of the major barriers was the demographic composition of the workforce population. 90% were Spanish speaking, likely contributing to the limited knowledge and access to services. We created promotional flyers in both Spanish and English. We have also implemented monthly theme articles on various mental health and substance abuse issues, which we are posting throughout common areas at their facilities. Flyers are also being inserted into checks on a bi-weekly basis. This is just one example of how we are leveraging real-time data to create strategies to stay in front of employees. So as we continue along, discussing different topic areas, make sure that you're thinking about how your employees can receive information most effectively, especially if a large percentage are remote, are first responders, work in healthcare, or other essential employees. Unfortunately, many industries are currently experiencing layoffs or furloughs, such as some retailers, some manufacturing companies, and many in the hospitality space. Employees in these industries are experiencing worry about losing income and concern about how their families will manage. We are providing these industries with information and tools for employees to assess their finances, to develop a plan, and of course, a budget. We're providing information sheets regarding cutting costs, information necessary to register for unemployment, and even resources such as the Do Not Pay app, which recently started enabling people to file for unemployment insurance via an app at no cost instead of waiting on the phone. This is just one example of how we're keeping ourselves informed of new technologies and services. Finally, we are providing information and resources on checking credit scores and ways to find hidden opportunities to work with creditors. We realize that support has to extend beyond mental health to other areas of life, as well as to family members and workers impacted. These are some communication tactics we have implemented that you can consider for your organization, regardless of the industry or types of workers that you have. As mentioned, we are scheduling a weekly touch base with all accounts and creating communication campaigns surrounding COVID-19 as we continue to learn more. This includes custom emails providing step-by-step instructions on how to access COVID-19 resources within our WorkLife online portal. We've created webinars, offered both live and recorded, to address personal stress responses common during COVID-19, which Kelly discussed a little in the beginning of this webinar. In these webinars, we provide information and strategies for self-care and appropriate ways to address any mental health issues with others. Information sheets have been developed to outline self-care tips, normal human responses during crisis situations, resources for accessing quarantine updates and information from the CDC and WHO. For those struggling with substance abuse, we refer resources such as virtual AA meetings and NA meetings. Also being offered either live or recorded are de-stressing exercises providing psychoeducation on different mindfulness stress reduction activities. These exercises include progressive muscle relaxation, guided imagery, and guided visualizations, meditation, and deep breathing exercises. With all of our organizations, we are continuing to leverage real-time data to ensure we are being successful in our efforts to creatively engage employees. Ongoing, we're creating new content to meet the needs of our organizations and their staff based on real-time data being gathered. If you do not already offer varieties of materials, we think you should consider doing the same to increase the chances team members will take advantage of services and tools that you make available to them. What works for Perspectives and our customers is the online portal we expanded, in which we share special resources on COVID-19. Here, employees can learn about the virus and discover the steps to prepare their families for the daily living challenges that may arise. From adjusting to remote work from home and how to find remote employment and properly seek medical attention to treat the illness. Some additional highlights are resources for parents and caregivers, financial information, and tailored information and resources for frontline workers. Creating and expanding an existing portal might work for you to enable your employees to access at their convenience. So beyond our WorkLife online portal, we are offering a variety of ways for employees to contact us 24 hours a day, 7 days a week, and 365 days a year. The primary point of access continues to be our 800 number. However, employees can also chat or email with our counselors. All of our customer organizations can tap our Spark mobile app. This allows individuals to access different resources for personal and professional well-being, and is also a way to schedule and manage counseling appointments. We share this slide as a model for you because providing resources from just 9 to 5, Monday through Friday, via telephone or video conference will only make it difficult for your entire population to get the support that they need. So we hope you found that this session informative regarding the type of individual mental health and other work-life challenges we are seeing recently, as well as what organizations and specific industries need. We're happy to take a few questions. With the time remaining, you can always reach out to us by phone or email to learn more. All right, Jonathan, so are you seeing any questions from participants?
None coming in right now. Got some good feedback, very important information. Thanks for sharing. There is some interest in being able to access this presentation later. So we will be sending this around, like I said, within or before the week's over. So everyone will have access to the entire presentation as well as some additional information that we'll be sending.
Great.
Jory, are you able to switch it back where I'm the host again or the presenter?
I think I have that.
Kelly.
Yeah, you want me to stop sharing my screen?
Yeah.
Okay.
All right. I think this will work here then.
There you go.
My mouth is dry.
So I just want to thank you, Kelly and Jory, for your time today and for sharing your experiences and the way that you've been helping support both our customer organizations as well as their employees. And I want to thank everyone that was able to attend today for sharing your time with us this afternoon. And we hope that you found this insight into the perspectives world valuable. It was mentioned earlier too, but keep an eye out for an email that will be coming about the next session. And now that we're going into our full second month of working from home, we're going to be looking at employer policies, some legal ramifications, and some other aspects about working from home. We're calling this Working From Home 2.0. So stay tuned for that. I'd also love to have a conversation with anybody that was in attendance today to explore ways that our organizational consulting group may be able to help adapt to this new reality that we're all operating right now, or maybe if some virtual workshops would help to keep your employees engaged while they're working remotely. And if you'd like some more detailed information about our robust employee assistance program, I'd love to have a conversation. You have my contact information on the last slide, and the follow-up information we'll be sending around. You will have my information that way. Both my phone number and my email. And finally, while most of us right now are able to do our part to help slow the spread of this virus by staying at home, from the bottom of my heart and from our collective hearts, we want to thank the first responders, we want to thank the healthcare providers and the essential workers for really being on the front lines and for being our defense against this virus and for helping to keep the rest of us going and the rest of us sane. So without that, or without anything else, I want to thank you all again. Look forward to seeing you guys in a couple weeks. So stay safe and be well, and don't let separation turn to isolation. Thank you, everyone.
Thanks.